Welcome to Liberators United. Also, voices for victims. I have a story to tell. Voices for victims. We're speaking today about medical malpractice, gaslighting, cover-ups. And I'm addressing all other victims out there who have suffered from some medical, physical damage by people who messed up and didn't care to own up to their malpractice actions. I'm reaching out for someone to have a voice. It's time to speak up. You can suffer from things that happen to you, surgeries, treatments, medicines, what have you. But we as a people need to speak up about it and cry out. But when I speak to you about gaslighting, that's what they do they go into gaslighting mode when they feel like one of their co-workers or one of the physicians or the nurses or whoever has messed up. They go into the gaslight mode to cover up. I have a story I need to tell you about that took place March 31st of 2022. And I was the patient, and I had a procedure that needed to irrigate my bladder. This particular nurse who presented herself as an RN came to my home and proceeded to try to do the procedure. The procedure was done with saline water and a catheter. So she told me to lay back, and she took a catheter and jammed it through my genital, and she pushed it so firmly and hardly that it went, and it erupted my urethra, and punctured my prostate. I screamed with pain, and as I raised up, I saw she had drawn out over a liter of blood. I immediately told her to quit what she was doing and remove the catheter. She didn't even know how to do that. So she reached and grabbed a pair of scissors and cut it, and more blood issued out. She said, "You want me to call someone?" I said, "No, I called my caregiver." And she was over there in a few minutes, in which they called the paramedics, and I was taken to the hospital. Arriving at the hospital, one of the things they asked me is, how did the injury occur? And no sooner as I said a health care nurse injured me, the entire mood changed at the hospital. They put me in a room. I bled all over the hospital. They put me in a room and they wrapped my genital in with a gauze and some type of tape, or what we call it. I can't call the name of it, and then they put ice packs and sent me home. I continued to bleed all night that night, and that Sunday afternoon, my brother took me to another hospital. The same thing took place. As soon as they found out the injury was caused by a home health nurse, they gaslighted and sent me home. Then I bled all night, and I was extremely weak and traumatized. And so I was going to another hospital when they said they needed to take me to the nearest hospital, which was the one I went to at first. And having known the situation, I was using my phone to record what was happening. And security came in and said, "You have to delete everything that you have recorded, or we will not treat you at all." And they watched me delete everything that I had recorded. At that time, I was then hospitalized, and the specialist urologist came in, and I suffered for one whole week there at the hospital. Think about after 2 or 3 days, then the bleeding subsided. But I was still in a lot of pain, having muscle spasms and everything. But anyway, I suffered from that condition, and I began to seek legal advice. And found someone that said they would take the case. They agreed to take the case, and I had sent them all the information all the documents. I have pictures of everything. And this was a lady. And then after she took the case, she turned it over to one of her assistants. The case was filed, and after a little bit of time had lapsed, it seemed like they were dragging their feet. But anyway, I received documents, I signed documents, I sent documents in. But everything seems a little strange, because the one thing that we tried to look up was the name of the nurse to check her license, because she never really acted professional like an RN. And in fact, she almost looked spaced out, like she may have been on allegedly, some type of drug. But anyway, we put her name in, nothing came up. We checked LPN, nothing came up. So when the case came forth, I said, this nurse doesn't appear to have any license. And she was not aware of the type of catheter to use. She used the wrong type of catheter. She didn't appear to even know that you needed to have lube on the catheter before inserting it. All the things that a normal nurse would know, all the procedures that a normal nurse would do, she didn't do it. And that's when I really seen the cover up for malpractice. And how they will go to every extent to not take responsibility for their actions. This is a horrible thing for people in any circumstance. It's horrible, the suffering and the cover-up that goes on for people that will not take responsibility for their actions. And so I'm reaching out to also everyone that may have an incident that they have been mistreated in such a manner, or their relatives have been mistreated. I think the medical profession owes more than this. Sometimes they give you the wrong medications because they don't take time to check. Sometimes you end up with worse conditions because they haven't read the labs and rightly and missed something, overlooked something. They don't notice the condition when it's starting. Everything has a sign when it's beginning. They've overlooked. So if you or someone you love have suffered mistreatment, malpractice, gaslighting, it's time to speak up, people. They charge too much. They make too much to treat us in such a manner, to disrespect. If you're trained, you should be aware of what you're doing. So reach out, leave a message, leave a message in my inbox. It's time to have voices for victims. I'll be back with more information.